let's talk about something really important: oral sex and cancer. Many people don't realize there's a connection between the two. We need to have this conversation openly and honestly. It's about protecting your health and the health of those you care about. Knowledge is power, and understanding the risks can help us make informed decisions about our well-being. The link between oral sex and certain cancers, particularly throat cancer, is often caused by a virus called HPV, or human papillomavirus. HPV is incredibly common. It's a virus that can affect anyone who is sexually active, regardless of age, gender, or sexual orientation. In fact, most people will have some form of it in their lifetime. It's estimated that nearly 80% of sexually active people will contract HPV at some point. There are many types of HPV, and some are riskier than others. Over 100 different strains of HPV exist, but only a few are known to cause cancer. Certain types of HPV can cause changes in the cells of the throat, which may eventually lead to cancer. These changes can be slow and often go unnoticed for years. HPV is primarily spread through sexual contact, including oral sex. This means that anyone who is sexually active is at risk of contracting the virus. It can be passed from one person to another even if there are no visible sores or symptoms. This makes it particularly challenging to know if you or your partner have been infected. This is why understanding HPV and its transmission is crucial for protecting ourselves and our partners. Education and awareness are key in preventing the spread of HPV and reducing the risk of HPV-related cancers. It's important to be aware of the potential symptoms of throat cancer, especially if you're engaging in oral sex. Human papillomavirus, or HPV, is a common sexually transmitted infection that can lead to throat cancer. Understanding the symptoms can help in early detection and treatment. Early detection is key when it comes to successful treatment. Regular checkups and being vigilant about any changes in your health can make a significant difference. One common symptom is a persistent sore throat that doesn't seem to go away. This isn't just a typical sore throat from a cold. It lingers and can be quite painful. You might also experience difficulty swallowing or notice a lump in your neck. These symptoms can be alarming and should not be ignored. Changes in your voice, such as hoarseness, can also be a warning sign. If your voice becomes hoarse and doesn't improve over time, it's worth getting it checked out. If you experience any of these symptoms, it's crucial to see a doctor right away. Early consultation with a healthcare professional can lead to early diagnosis and better outcomes. Don't panic, as these symptoms can be caused by other, less serious conditions. However, it's always better to be safe and get a professional opinion. However, getting checked out is always the best course of action to rule out anything serious and ensure timely treatment if needed. Remember, your health is your most valuable asset, and taking proactive steps can make all the difference. Section 4. Protecting yourself, Prevention and Early Detection. This section is dedicated to understanding how we can take proactive steps to safeguard our health against HPV-related throat cancer. Prevention and early detection are key components in the fight against this disease. The good news is that we can take steps to protect ourselves from HPV-related throat cancer. One of the most effective measures is getting vaccinated. The HPV vaccine is a powerful tool in our arsenal, designed to prevent the types of HPV that are most commonly associated with throat cancer. One of the most effective ways is through vaccination. The vaccine works by stimulating the body's immune system to fight off the virus before it can cause harm. It's recommended for both boys and girls, ideally before they become sexually active. The HPV vaccine is incredibly safe and effective at preventing infection from the types of HPV that cause most throat cancers. Studies have shown that it can reduce the incidence of these cancers by up to 90%. It's a simple yet powerful step you can take to protect your health. Practicing safe sex is also crucial. Using condoms can significantly reduce the risk of HPV transmission. It's important to have open and honest conversations with your partner about safe sex practices. Using condoms during oral sex can significantly reduce the risk of HPV transmission. This simple precaution can make a big difference in preventing the spread of the virus. Regular checkups with your doctor, including throat examinations, are also important, especially if you have any risk factors or concerns. Early detection can lead to more effective treatment and better outcomes. Don't hesitate to discuss any symptoms or worries with your healthcare provider. Section 5. Taking control of your health, your next steps. We've covered a lot of important information today about oral sex and cancer. Remember, knowledge is power. Talk to your doctor about HPV and throat cancer. Ask about the HPV vaccine for yourself or your loved ones. By being proactive and informed, we can make choices that protect our health and well-being.